Hello, everyone, and welcome back. Today, we're going to get into a particular fascination of mine, testosterone therapy. We're going to talk about the basics of testosterone today, its implications on the cardiovascular system. I'm going to try and clear up some misconceptions and lay the foundation for some basic understanding of how testosterone affects your cardiovascular system. So, let's get started. Testosterone therapy is more common now than ever before. But with that popularity comes confusion and fear, especially around heart health. Does testosterone harm your cardiovascular system? Or is low testosterone a bigger threat? In this video, we'll explore the real data, the real mechanisms, and the latest science behind how testosterone affects your blood vessels, your inflammation, and your lipid system. By the end, you'll have a clearer picture of where the risks lie and where the promise lies. So let's rewind to where all this started. Men have a higher risk for heart disease than women. For decades, people assumed testosterone may be at least partly responsible. It seemed logical: higher testosterone, more heart disease. Well, that idea became entrenched. It was simple and intuitive and hard to shake. Over time, researchers began to see the opposite pattern. Men with low testosterone tend to have the worse metabolic health, more obesity, more diabetes, and even more heart disease. In fact, low testosterone is consistently associated with higher cardiovascular risk. Here are some real numbers. A large cohort study found that men in the lowest quartile of total testosterone had a 40% higher risk of 20-year mortality compared to men in higher quartiles. And that was after adjusting for age and other comorbidities. In the large NHANES analysis, low testosterone was linked to 2 times a higher risk of cardiovascular mortality, double the risk. Now, these are just 2 observational associations and studies, but there are many more to support the same observation. Low testosterone reflects poor general health, chronic illness, and higher inflammation. Then, in 2010, things became even more confusing. There were a few experimental and retrospective studies that suggested that testosterone therapy might actually worsen cardiovascular risk. Because of those, the FDA issued warnings and many clinicians became wary. The problem was those studies had serious flaws. There was a small population size, poor controls, statistical manipulation, and even misclassification of women in male studies. The loud media messaging overshadowed the methodological issues, and testosterone was deemed a risk despite the flaws. This has been the situation and the confusion since then. Now, fast forward to 2023, the TRAVERSE trial, the most rigorous, large-scale randomized study to date about testosterone, enrolling over 5,000 men, followed them for about 2 to 3 years, and compared testosterone gel versus placebo in men with clinically low testosterone levels. The key findings: no increase in major adverse cardiovascular events, no increase in heart attacks, strokes, or cardiovascular deaths. But TRAVERSE also reported slight increases in atrial fibrillation and pulmonary embolism in the testosterone arm. Now, to be fair, treatment levels they were achieving are not the same as the treatment levels we achieve in practice. There may be some inconsistencies in reporting data. That being said, those adverse outcomes of atrial fibrillation and pulmonary embolism were infrequent but statistically significant, and the reasons have yet to be teased apart. So the narrative is shifting not from risk to full safety, but to nuance. Testosterone therapy is not inherently dangerous when dosed properly, but it's not without caveats. Context, dose, monitoring, and patient selection all matter. So with that foundation laid, let's move on to the systems where testosterone actually works: lipids, inflammation, endothelial function. That's what we'll talk about today. Low testosterone was associated with more abdominal fat, higher blood sugar and insulin resistance, poorer lipid profiles, and more inflammation. So one of the first things people mention when talking about testosterone and heart health is cholesterol, especially HDLs. It's true that testosterone therapy can actually lower HDL cholesterol, but that's not the whole picture. HDL isn't just about quantity, it's about function. Multiple studies show that testosterone doesn't impair, but it may even improve HDL's function. It improves its ability to remove cholesterol from the arteries. Meanwhile, testosterone also tends to reduce total cholesterol, lower triglycerides, improve LDL particle size, and reduce small, dense LDLs. It also improves insulin sensitivity, which directly improves LDL metabolism. In men with metabolic syndrome or prediabetes, testosterone therapy often reduces ApoB, and that's a stronger predictor of cardiovascular risk than LDL alone. So while a slight drop in HDL may sound bad, it doesn't seem to translate to worse outcomes, especially if the overall lipid environment improves. The lipid effects of testosterone are modest but generally favorable, particularly in men with metabolic issues. Now let's talk about chronic inflammation. This is one of the main drivers of atherosclerosis and plaque instability. Low testosterone is consistently associated with higher levels of C-reactive protein, tumor necrosis factor alpha, interleukin 6. When testosterone is brought back into normal range, these inflammatory markers often fall. Randomized trials and meta-analysis have shown that testosterone therapy can reduce C-reactive protein by 20 to 30% in men with underactive testosterone or hypogonadism. There's also evidence that testosterone influences the immune system by shifting macrophages from the inflammatory M1 state to a more healing-oriented M2 state. This matters because inflammation doesn't just start heart disease, it drives its progression and increases the chance of sudden events. By modulating inflammation, testosterone may play a stabilizing role in the vascular system. Now let's talk about blood vessels. The endothelium specifically. That's that thin lining inside your arteries. It's central to cardiovascular health. It regulates blood pressure, keeps the blood flowing smoothly, and prevents blood clots. Testosterone directly improves endothelial function by increasing the activity of an enzyme called eNOS. And that's the enzyme that produces nitric oxide. Nitric oxide is the body's natural vasodilator. It relaxes the blood vessels and makes them open up more. That allows improved oxygen delivery and reduces shear stresses on the walls or stress from blood flowing that may be from elevated blood pressure. Studies in both animals and humans show that testosterone therapy increases nitric oxide production, improves blood flow, mediated dilation, and reduces arterial stiffness. These effects have been especially noted in men with coronary artery disease, men with type 2 diabetes, and men recovering from heart failure. Importantly, these vascular effects are androgen receptor mediated. They're not just from estrogen conversion, because estrogen is important. They're direct effects of testosterone acting on the receptor in the endothelial cells and the vascular smooth muscle cell. That means testosterone has its own unique role in supporting vascular tone and blood flow, especially in the aging male heart. So let's recap what we've covered today. We began by revisiting some historical fears around testosterone and how modern data, especially from the TRAVERSE trial, has reshaped our understanding. We then walked through how testosterone improves lipid metabolism, reduces systemic inflammation, and enhances endothelial function. Remember, it boosts nitric oxide for better vascular tone. All of these effects suggest that restoring testosterone in deficient men, when done correctly, can support cardiovascular health rather than threaten it. But we're not done yet. In part 2, we'll dig into some of the most powerful and underappreciated aspects of testosterone on the cardiovascular physiology. So thanks for tuning in. I hope you enjoyed part 1. If you did enjoy it, hit like. If you think someone can benefit from this post, share it. And if you want to hear more, hit subscribe. I'll see you for part 2.